This paper looks at fungal infections acquired following COVID-19 infection. So we've learned that COVID can be complicated by secondary invasive fungal infections, stemming primarily from lung damage or immunologic deficits from the virus, where there have been many fungal infections associated with COVID-19, initially predominated by pulmonary aspergillosis, which is a fungal ball growth that develops in an area of the lung, where it can be a very serious infection with pneumonia. But recent reports have shown the emergence of mucormycosis, which can affect many parts of the bodies, where symptoms include headache, sinus pain, vision changes, swelling around your eyes, and spreading of skin ulcers and more, typically affecting people with diabetes and weakened immune systems. Candidiasis, which is a yeast type infection, typically of the skin or mucous membranes, and endemic mycoses, which are environmental fungal diseases, where those at the greatest risk for invasive fungal infections in COVID patients include people that have leukopenia, neutropenia, lymphopenia, immune dysregulation, poorly controlled diabetes, structural lung disease, and or other comorbidities, in addition to antibiotic use predisposing to fungal colonization, or some therapies for COVID, such as corticosteroids or immunomodulators. One of the things we learned prior is that a COVID infection subsequently leads to transient loss of ciliary motility from the trachea. These are essentially little windshield wipers that move back and forth to help clear things in your system and are an innate defense against airway pathogens. So when those are damaged, they don't clear as well, meaning that it's easier for things like fungi to accumulate. Furthermore, changes to your body, such as having low oxygen exchange, the hypoxia, and changes in your iron metabolism can allow it to be a more beneficial environment for fungi to grow and take advantage. So if a person has COVID, it's very important to control the environmental conditions that they're existing within. Even in hospitals, there's a few different ways where a person can come into contact with fungi. Construction of new hospitals or units can cause an increase in fungi. Repurposing of non-critical care areas for care of COVID patients can increase this. And there's also been an association with the use of negative pressure rooms and increases in candida levels. Furthermore, contaminated respiratory equipment like nebulizers and oxygen canisters are potential sources of fungi. The paper then cites a website called covidandfungus.org, which takes us to this website right here, where doctors can submit case reports for their invasive fungal infection patients. And you can also peruse news articles on the subject. Different ways you can confirm fungal infection is through a lavage of the lungs, or through PCR testing of blood, or even culturing of sputum, the stuff you produce when you do those deep coughs.